Hello, welcome to this interview. We have with us today, we have the pleasure of having us Nacho Esteban, CEO of 24Genetics. Thanks a lot for coming to our offices.
It's a pleasure.
And so the idea is that we're going to have an about 15-minute talk about what 24Genetics does and what is the idea behind investing in this company.
Good.
So let's get rolling. What is 24Genetics?
24Genetics is a DNA company for DNA testing for direct to consumer, but we also do B2B. 1/3 of our business is B2B. So we just take some saliva from our customers all over the world. We have thousands of customers in more than 100 different countries. And from that saliva, we do like 8 different DNA tests, from health till skincare, nutrigenomics, many things.
Tell us a little bit about genomics. So this is something that is relatively new to both consumers and patients. So what do you do exactly?
Genetics is going to change everything about how we manage our health and wellness. So it started being direct to consumer in the US, mainly for doing ancestry. That is, we can see in the DNA where your ancestors coming from. And then more and more is growing the health and wellness part. So any kind of decision about your health or wellness should be done starting from data, then you put knowledge on it, and then you take the decision, right? So it is not the same decision if you go to a bad hospital in a bad country with a low number of tests or whatever they do to see how you're doing, that if you do it with a lot of data and with a lot of knowledge. So what we do is we take the most important data that a human has, that is his DNA, and then we put a lot of knowledge on top of that. At the end, what kind of decisions do you make? You can avoid a lot of illnesses. You can take decisions as important as what kind of diet should I take if I want to lose weight. You can avoid having injuries doing sports. You can choose, or your doctors can choose much better what kind of drugs you should have, because some drugs probably are going to be toxic for you and some of them are not going to be valid. So these are the kind of things that you can see in the DNA.
Hello, I'm Julia, your nutritional assistant from 24Genetics Artificial Intelligence. I use information from your DNA to create personalized diets, taking into account your tastes, lifestyle, and specific needs. I can offer you tailored advice or design your diet for each day of the week. You can ask me for the shopping list and even have me explain the recipe step by step and send everything to you by email. And if there's something you don't like, or if you think something doesn't agree with you, let me know. The more you tell me about yourself, the better I can advise you, taking into account all the available information, whether genetic, clinical, or related to personal or cultural preferences. We can chat through my website, or if you prefer, we can do it via WhatsApp. We'll give you my number, and you will have me available 24 hours a day, 365 days a year, in the language of your choice. And if you don't like to write, you can send me a WhatsApp audio message, and I will give you my response. It's that easy, but I can do many more things. I'm going to tell you some examples. If you are in a restaurant and don't know what the smartest thing to order is, you just have to send me a photo of the menu, and I will tell you which options are the most suitable for you according to your goals, your genetics, and your nutritional profile. Do you want to keep track of the calories and macronutrients you are eating in your daily life? You just have to send me a photo of what you are going to eat, and I will calculate the calories and main macronutrients, so you can know your daily caloric intake and thus calculate your caloric deficit or surplus. If you are shopping and are unsure between certain products, tell me which ones they are or send me a photo, and I will give you my most objective opinion considering everything I know about you. Do you want us to design your weekly menu together? Perfect. Recommend that we start with Monday, and thus, with your comments and evaluations, I will adapt the menu for the following days to your tastes and habits. If you need to go shopping, no problem. I can help you too. I can prepare a detailed shopping list for you so you can make all the menus we have designed together. If you have guests at home and want to prepare a special dinner, I can help you by suggesting the most surprising dishes that align as closely as possible with your nutritional goals. In addition, I will teach you how to make the recipe step by step if you need it. As you can see, my possibilities are almost endless. You just have to subscribe to my services and we can start working. Welcome to the new era of health and wellness care from 24Genetics.
Okay. So you've been doing this for a few years. How did the project start, and who are the people behind it?
All right. Well, we started this project with a very little team, and just to prove ourselves that we were going to be able to do a test like the test we were looking at in the United States. And what we found out is that we will be able to improve those tests by a factor of 10, and we have done that. So we started the team just with a couple of biologists and myself, and then we pretty fast start doing the first test and sell it, and using the money from our revenue, we start growing and hiring more scientific people and growing more and more and more. And the first part of our company, it was just about DNA. But since 1.5 years ago, we have seen that there is a new revolution on health and wellness, and health and wellness and everything. And that revolution is AI. Artificial intelligence is changing everything, and for health and wellness, it's even more. The point is that our purpose is to help the people to take better decisions on health and wellness using genetics. And sometimes that's not easy, because at the end you have a report that in our case is a PDF, and then you have the final customers and their health professionals taking that report into account in order to make decisions. And because the use of genetics in things like nutrition is quite new, sometimes it's not that easy to take the test and then convert that into actions. But right now, we've been investing a lot on AI. We have solutions that are just great. We have a new service. There's our 24Genetics nutrition assistant based on AI, that the nutritionist, they can use our AI to make the job much faster and taking everything into consideration. For example, if you want to take into consideration what the customer wants to achieve, their goals and the taste, and then the first step is quite easy. If you want to take into consideration also the DNA, it's a little bit more complicated. But if this person have a lot of, maybe this person is having some drugs and some illnesses, and maybe they have some allergies, everything becomes more complex. So our AI is able to mix everything up and make a plan for this person. Starting from, okay, let's make the diet for this week. And you know, the nutritionists, they start using the thing just to make sure they're doing it right, and they do it faster. And after we tested with the nutritionist, we start offering this solution to the final customers. So right now it's as easy as you have it in your WhatsApp. So for example, I don't know, if you're in a restaurant and you don't know what to choose from the menu, you can just make a picture of the menu, send it by WhatsApp to our assistant, and she will tell you what kind of things you should order.
It's a she.
It's a she in this case. Yeah, Julia is our AI assistant for nutrition, right?
All right. So this is someone who has already had his or her genome sequenced. So you already have the genetic information.
Exactly.
And then you're providing new information such as diagnostic, the food you want to take, etc. And the
Exactly.
AI analyzes that, matches it with your genes, and offers you advice.
Exactly. Starting from the beginning, we do the DNA test for this customer. We send them the report for nutrition, and after that, and this is quite new. This is from 10 days ago. This person, the customer, receives a video from our AI avatar explaining his results, but not explaining their results, explaining his results, and in any language, in Catalan or in Arab, on any language. So you receive the DNA report, and then you receive a video, 3-4 minutes, and say, hey, Nacho, these are your results. I have seen that your vitamins D, you cannot have it, you should eat more than that because you are not, because your genetics is not perfect for vitamin D. And these are the kind of foods that you can have. And she's like 3 or 4 minutes telling you advices from your DNA test. And then she tells you, and if you want to keep working with me, you can just take the subscription, and then you will have me on your WhatsApp. And then from the WhatsApp, you can ask anything. And the first thing she does is she's asking you the same questions that any nutritionist would do. So she's making you like 40 questions. So she knows perfectly who are you, and if you have any illnesses or whatever. And you have to take into consideration that 85% of our customers are from outside of Spain, so from many countries all over the world. So she has to make sure that she's offering the diet from the country where you are from. So, and then you can use it. You can use it to make a plan and to follow the plan of your nutrition, or just to make a question. For example, I don't know if to become this kind of diet, vegetarian diet, or I'm not sure if intermittent fasting is good for me. You can ask these kind of things, but directly through a audio message. That's it. It's as easy as that.
So you're not planning to replace nutritionists or doctors, but you're providing an easy and fast alternative that everyone can carry around.
Exactly. In one side, we are giving tools to the professionals, so they can do their job faster, and taking more data into consideration. And at the same time, we are building what we believe it will be a new standard. So, some time ago, the only way to get a service from a nutritionist will be to go into a clinic and have an interview over there. And then some insurance company and some clinics, they offer you to do it over a video conference. No? So these are the kind of things that you have more tools. And this is one more tool. It's not something that you can choose from, or I do it one way or on the other way. Sometimes what I say is that it replaces that phone call that you do to a friend that is already a nutritionist, and to make a fast decision. For that, it's just perfect. And also to keep track of what you eat. And for example, the typical case that you are not sure if you should eat, I don't know, these snacks or those snacks, you make a picture of them, and then which ones are better for me. Or sometimes you are eating a nice dish and you say, well, maybe this is 300 calories, but you're not sure. You just make a picture, and she will tell you how many calories, how many carbs, how many proteins and stuff. And also put that information into your profile. So at the end of the day, you know exactly how many calories you are eating. Well, not exactly, it's an approximation, of course. But it's much better than a human can do on guessing how many calories a meal can have.
And then you can share that information with your professional.
Absolutely.
Understood. So behind that, what's a business model? So how do you make money with that?
Yeah, we started just selling the product, selling the DNA test. That was our first business model, and 2/3 of that was direct to consumer. 1/3 is B2B, and in B2B we are doing white brand. For example, we are doing that with Eurofins. So Eurofins, they send us the DNA of the customers, and we do the report, and we just put their logo on our report. That was our business model till few months ago, that we started switching to a subscription model. And from this year, we've been changing and making all these tools, these AI tools, they are AI services, and we are switching the business model to a subscription model. So in one hand, we have, yes, we sell DNA tests. Also, we sell DNA test updates. So for example, if you get today our all-in-one test, and in 1 year and a half we do an upgrade on whatever, if you want it, you have to pay for that, and the customers they pay for that. And so we've been already having some revenue coming from on all customers, and right now we are adding these updates with the AI assistant. So paying a subscription, you make sure that your DNA tests are always updated, and you have all the tools. Right now we have the nutritionist, but we're going to have as many tools as tests we have.
So artificial intelligence and healthcare have indeed been the toast of the investment lately. Depending on which figures you want to believe, about 1/3 of the venture capital investments in health tech has been in artificial intelligence, health companies, and at any rate, about $30 billion invested in the last 3 years. Obviously, investors are going absolutely crazy over artificial intelligence in healthcare. How does 24Genetics fit into that? How do you position yourself in that market?
Yeah, we started with artificial intelligence doing machine learning just to make our test better. So that was the first step we took like a few years ago. And but then we saw that artificial intelligence is going to change the way that we manage our health and wellness, in a radical way. So we invested so much in order to train these assistants, and I think we are in the right place at the right time. When we started DNA tests, we were just following the first company that were doing that in the USA. But today, with mixing DNA and artificial intelligence for assist our customers, we are pioneers. I mean, there's no other company in the world that you can manage your nutrition using your DNA and artificial intelligence to make good decisions. So that's a very important thing, and we are doing things that they do not exist yet. So making DNA tests was quite easy, because once you have a test that is better, you can communicate that very easy. So okay, we have a new test, it's better because it's bigger, because our algorithms, because of this information, is much better than that. Right now we are doing something that is not a standard, it's new. But at the same time, that put us in a position that we can own a market that is going to be huge. DNA test for consumer is about $2 billion a year, but today just online health assistant, not health assistant, wellness assistants. I mean, sports and nutritionists and skincare, this kind of things, is billions. So our market grows a lot with this kind of services. So I think we are in the right place at the right time. We are in genetics, that is booming the industry. We are in artificial intelligence. We are in health and wellness, that it's all the time a market that is increasing, and we're doing it well. I mean, we're increasing our revenue. We've multiplied by 3 our revenue since the last capital rising campaign, and last year we have 20-something% of profit. So we're in the right place at the right time, doing the right thing.
So before we finish the interview talking about money, how can you, so anyone who's listening, I would like to have a go at this Julia, was it?
Julia.
At this Julia assistant. How is it? You just have to go to your website? How do you do it?
Well, you just get our subscription in the website. It's 19 euros a month, and then you have a chat on the website that you can upload photos and send audios also. But the most convenient way is just through WhatsApp. So you take the WhatsApp, you say, hey Julia, I don't know, I'm going to have lunch today with Daniel, I don't know what to eat, maybe fish, maybe this kind of meat, what do you suggest? And she will answer me right away. So it's very easy to use.
Does she have a face or only a voice?
Absolutely.
She has a face.
Has a face, and the face, you can see that face when you get the report, and then you get the video of that face telling you, and you do not notice that it is not a real human, but indeed it is AI.
Right, I think we'll get a lot more of that in the future, I'm sure. So, okay, just finishing. So, investment is open on the platform right now, with the minimum tickets 500 euros, I think. So, investing is easy. How will people make money, and when?
All right. Right now, we think that we're too small to have the exit that we need. So, you know, we've been investing this last 3 years in making everything automatic and making these new great products, and we couldn't spend much on sales and marketing. And even though we multiply by 3 our revenue. So we want to use this money mainly 70% on marketing and sales. So we believe that in 3 years, we're going to multiply our revenue at maybe 4, 5, maybe more. And that would put us in a very good position to make a good exit. And it can, you know, there are so many players that we will be a nice option to buy from one of our competitors, from an insurance company, from a big lab, or even a big pharma, because one great thing that we have is our database. We have tens of thousands of DNA, people that we have their DNA, but with a big difference with any other database is that we can communicate with our customers. So for example, you know, when you want to do a clinical phase for some drug, each time you need a participant, the average cost is like 6,000 euros to get one participant. Sometimes this company, they need somebody that have special genetics. So sometimes they have to sequence thousands of people just to get a few hundreds of participants. We can do that just pressing a button. So that's a huge advantage for pharmas, and also will be a service for us for the pharma. So only for that, I mean, it will be very easy for a pharma to buy us and just to get that.
Understood. So are you do you dare balance a number? What kind of profit do you think an investor could make?
Well, let's see. I mean, you know, right now I think we are in a bottom of a wave of valuation. You know, we have multiplied by 3 our revenue, but our valuation has improved only 40% because I think we are in the bottom of a valley. I think if we multiply by 4, by 5, I think it's going to be more. And I guess our valuation is going to even multiply by more. So for that time, I think we can get a very nice exit.
Understood. Well, so Nacho, thanks a lot. It's been a pleasure chatting to you. Hopefully you have a much clearer picture of what the company does and who's behind it. Investment now open on capitalcell.com. Just don't miss it. Thanks, Nacho.
Thank you.